Hello, everyone, and welcome to the We Win podcast, powered by Accelerate Her Africa in partnership with the Human Pattern Institute. So what does it take to spend 2 decades strengthening health systems across an entire continent and then realize the missing piece isn't infrastructure, it's the individual? Today's guest has done something extraordinary. She's built health programs from the ground up. She's taken HIV prevention, TB integration, and maternal health services from concept to scale across sub-Saharan Africa. She's trained teams, influenced policy, and worked with governments to ensure hospitals are ready when patients arrive. But here's what makes her story different. After 2 decades of large-scale impact, she recognized something critical. You can build the best health systems in the world, but if individuals don't understand their own risks, don't monitor their own health, and don't make lifestyle changes, those systems can only do so much. So she launched the Viedial Healthcare, a startup where she now serves as the Chief Operating Officer. This isn't about hospitals or government programs. It's about monitoring cardiovascular risks, tracking lifestyle changes, and putting preventative health in the hands of everyday people. Her journey asks us all an important question. How do we empower individuals to become the primary architects of their own health? I'm honored to introduce to you our guest, Dr. Lilian Anomnachi. So let's dive in. Hi, Lilian. It's such a pleasure to have you here with us today.
Thank you very much, Lolita. I'm really excited to be here.
Awesome. Lilian, you're widely respected for your work in system strengthening with TA Connect. You spent years fixing the big machinery of public health, working with governments and donors to ensure hospitals function and mothers survive. Before we talk about the future, I want to ask you about the past. What was the specific frustration or broken moment you witnessed early in your career that convinced you that treating patients one by one wasn't enough and that you had to fix the system itself?
Thanks for that question, Lolita. I think for me, it wasn't one broken moment, and it predates my career as a doctor. It started in childhood, really, working in my mom's orphanage. I connected to it, and the way, malnourished children seem to become brand new, healthy persons within a month of good nutrition, clean water, being well looked after, And as I grew, however, through secondary, post-secondary school, I became focused on becoming a pediatrician until I took a community health posting during my latter clinical years in medical school. This reignited my earlier passion for public health as I now knew it, and how the health of the community supersedes caring for one individual. I was sold on the idea that providing potable drinking water to prevent diarrheal diseases, for example, was more efficient than waiting in the clinic to treat one child who has come down with a diarrheal disease. And also that, maybe providing good nutrition and keeping children and mothers healthy was more important than waiting for their babies to die or waiting for the children to become malnourished. And in the latter years, when I now also went for my postgraduate at Johns Hopkins Bloomberg School of Public Health, the mantra, which is saving lives, a million at a time, really resonated with me. So this series of somehow unrelated events are what led me into public health and system strengthening quite early in my career.
Yeah, I can really see that journey from as a child working in your mum's orphanage and seeing children who are malnourished suddenly get better and live good lives, but also in your adulthood, understanding that it's important to prevent the illness in the first place by having access to, say, clean water to prevent cholera, for instance. So it's a preventative solution that you're suggesting. Okay, so you're often called a health architect. For the layperson, that sounds abstract. But when you are on the ground in the rural communities or negotiating with the state government, what does fixing the system actually look like? Is it building walls or is it changing mindsets?
It's actually a combination of factors, Lolita. There are lots of supply side and demand side dynamics at play here, And when we talk of the supply side dynamics, it includes, like you say, fixing walls or building walls, what we term infrastructural upgrades, training of healthcare workers, that's building their capacity so they know what to do, ensuring that health facilities have the necessary equipment and commodities that the people require when they do come, and that patient flow is logical even within a health facility, and that reporting systems for the data, for anything that's being done, are very well defined, and being utilized. Also, you can't even do this without having the right policies and frameworks in place. So there's a policy level or the governance level of all those things. But then when we come down to the demand side dynamics, we need to understand why the community is using or not using the services provided. We have to do aspects of community mobilization, which includes educating and addressing some of the delays that prevent people from accessing care, whether it's changing their health-seeking behaviors or ensuring that they are able to access health facilities within a short period of time. In some more advanced climes, they have ambulances and things like that. But what happens when someone gets sick in the hospital? So these are all the things that come into consideration when you talk about health architecture. It goes from governance, policy, supply side dynamics, demand side dynamics. So it's a multiplicity of factors, if I may say so.
Yeah, that's really clear. I understand that there is a holistic approach to healthcare that will drive both the supply side and the demand side. So the supply side ensuring that the health systems are in place, the people working, the facilities, the infrastructure. And then you have the demand side. Why are people coming to the community healthcare and why are they not? And putting that all together. But I have concerns about the Nigerian health system. How does that play in terms of this dynamic that you're trying to build?
The system in Nigeria is because we often tackle issues in Nigeria in a siloed manner. So you can train the best healthcare workers, you can paint the health facilities. We do a lot of inputs, right? We want to equip, we want to do that. But if the people are not coming and you don't take the time to find out why they are not coming, then all we have are white elephants, which nobody's utilizing. In other hands, if people are coming and the nurses are there, but they don't know what to do, then they don't get the quality of care that they deserve. And if they are coming and the healthcare workers are there and they are trained, but the health facility does not have commodities to give to the people, then you still haven't solved their problems.
Right.
So we're still going to have high mortality rates. So you see, you can't tackle this in silos. And often when people come together to work in the healthcare system, they often have a little bit of money to do one thing and not the other. So that's why right now we also focus on collaboration and partnerships, because just doing a little bit doesn't solve the problem. Then you have to look for other stakeholders and partners who are able to also do a little bit. And really, that is what the current government is trying to solve with a sector-wide approach to healthcare in Nigeria. But we are not there yet for obvious reasons.
Collaborations and partnerships, indeed. You've spent so much energy fixing the supply side, so making sure hospitals and governments are ready. But recently, you became part of a new venture, the Viedial Healthcare. which is a startup that focuses on the individual, specifically monitoring cardiovascular risks and lifestyle changes. Why this pivot now? Did you see a gap where the big system was failing to catch these silent killers until it was too late?
So thank you for that question, Lolita. And this is something that is deeply personal to me and eventually led to my involvement in Viedial. I'll tell you a story. A few weeks after my son's third birthday, we'd had this big birthday party and things like that. I found myself clinically, really critically ill, and I had to be hospitalized. That was my first time in my life, aside from childbirth, which I was being hospitalized. And I think I spent almost 2 to 3 weeks in the hospital. I was diagnosed as having diabetic ketoacidosis, which is a complication of type 2 diabetes mellitus. It came as a shock to me because I'd never even been diagnosed as being diabetic. And throughout my pregnancy, I know I'd done weekly monitoring tests and all those things. I'd never had even borderline or positive results. So diabetes and cardiovascular diseases is one of non-communicable diseases that have similar risk factors. And in recognition of this, and my co-founder's dad had also passed away from complications of diabetes and cardiovascular diseases. So we came together to say, okay, how can we help people recognize early some of these risks or these risk factors, So in recognition of that, we came up with the Viedial app, which can, both for busy professionals and people who are already sick, provides a screening tool to determine what their risk factors are and what are they doing that is contributing to this, and also provide contextualized, bespoke plans for healthy living, because a lot of these things, they tell you they are lifestyle diseases, right? So how can we help them provide plans that can be specific to them? We zeroed in on cardiovascular diseases because it's common both in Africa and in the first world countries, right? But as I stated earlier, the risk factors are common both for cardiovascular diseases and things like type 2 diabetes and or some other non-communicable diseases. I must point out, however, that this venture doesn't replace my current job, which is more of what Nigerians would term my side hustle, but it's born out of a shared experience and a desire to make a difference.
Yeah, I can really see how you came from pain to purpose, because from your experience, you were able to understand that you hadn't taken care of yourself, you hadn't checked in with your cardiovascular status, and now you're here developing a solution for people who may find themselves in the same situation. So it's a great thing you're doing here. So Viedial uses technology to help the physicians monitor patients outside the clinic, so tracking their lifestyle and risks in real time. You've mentioned that your aim is to have this recommended by physicians for high-risk clients. How does Viedial bridge the gap between the doctor's 15-minute appointment and the patient's 24-hour daily life?
Thanks for that. So the app has a dual purpose or dual goal, if you might say so. As you say, is to provide continuous self-monitoring and bespoke lifestyle adjustment support to people already diagnosed and on treatment for cardiovascular diseases to prevent the progression to complications like we see people having strokes, myocardial infarctions, and other complications of cardiovascular diseases. So the app provides further support aside from the highly inadequate short period that they spend in front of their physicians. The dream is to have it incorporated as part of the patient's care plan, right, providing support on other wraparound services like what do they eat, how fit are they, what do they do, what kind of exercises can they do, how is their mental health, what are their habits, other lifestyle habits, and other lifestyle events in a customized manner which is specific to the individual. The second goal is as a screening platform for everyone, because if you don't screen, you don't even know if you're at risk or not.
Right.
So it's for everyone, especially the very busy individuals, to assess their risk profile for cardiovascular diseases and other related NCDs, and also receive customized advice and a bespoke plan on how to remain or maintain their risk-free status. You would agree with me that we do a lot of things on our phones these days. So why can we not see how healthy we are, or if we're at risk of these NCDs on our phone without having to go to a health facility? And so when you now have require further monitoring, or you have a high risk, and you can now be referred to a health facility. So these are all the things that the app is meant to bridge.
I can see how this app has again factored in the preventative side by having this screening capability so that you already understand whether you're high risk or not. And not only that, provides a bespoke treatment plan. So if they're in front of their physician, they already know what treatment plan works for them. So it's a very robust app. Okay, cardiovascular disease is often a lifestyle disease. It requires behavior change, which is notoriously hard to engineer. As someone who understands human psychology from your public health work, is Viedial designing bespoke lifestyle changes that people will actually stick to, rather than just another app they ignore after a week?
So, and this is funny, because in the early days when we're just brainstorming, we actually talked about, we maybe have a website and things like that. But in the end, we emphasized that there's a need to individualize or have bespoke or customized plans for people, which is why we did not go with a website where we'd have just a general information for every single person to come and see, And even with the app, there's a subscription that is attached to it, and we don't propose just screen and go. You'll be advised to subscribe for as long as you can. It's not a one-off subscription, but through risk assessment, we get to know and understand the individual. It is not a website where the same information is for everyone to come and read, but via the individualized risk assessment, a user's health history, your habits, your job, your location, where you live and things like that, what you do for fun is understood. And based on this, a plan is developed, and a plan that is specific for you, even to like what kind of things you have in your local market or your corner shop and things like that, So it's a highly personal plan. And the subscription that you get includes access for a supporter of your choice, who would then act as an accountability partner to the user, knowing that human beings are social beings, So when you're alone and when it's just the app is, so to speak, faceless, you might say, why would this even affect me and things like that. But when there's someone else with you there to track your progress, and this person is a person of your choice, we think that you would have a greater chance of actually sticking to your plan than at least someone to prop you up even when you're thinking of ignoring and things like that.
Yeah.
So these are some of the things we have put in place to make it highly personal to you and to have a supporter of your choice who has access to what your plan is to go on this journey with you.
I like that aspect. I like the whole accountability side where someone can check in on me even if I don't check on myself. But more importantly, the app is personalized to my health plan. So it's for me, it's not general. So I think that would keep people coming back and checking in. And it's really something that is a long-term relationship as opposed to just a one-off situation. Okay, so in one role, you are an executive director of a major development organization, TA Connect. And in another, you're the chief operating officer of a tech startup, Viedial. So these are two different worlds. The development world moves at the speed of bureaucracy, and the startup world moves at the speed of tech. How do you mentally switch gears between these two roles without getting whiplash?
So once upon a time, I would have actually said these two roles were worlds apart too, but not so much anymore because there's a lot of infusion of tech in development currently. But I do understand where your concern stems from. Now, my role as Executive Director at TA Connect, still occupies all of my working days and time, and a significant portion even of my free time. But I devote the rest of my free time to Viedial as we're still building momentum gradually. Also, being an app, we did a lot of heavy lifting. When the app was being built, also securing all the necessary permissions, working with the developers, reviewing all the frameworks and all those things like that, But it was also built with a lot of artificial intelligence infrastructure, which more or less runs itself to a certain level. What we're focusing on now is the marketing angle and securing, as I mentioned earlier, country-specific approvals, which especially those that are required in certain developed climates and things like that. Generally speaking, though, from inception, we always had meetings and engagements and even outreaches on Viedial during the weekends when I'm on leave and things like that. So I've made it work. Apart from when I was doing the accelerator and incubation program, it was a lot of sleepless nights. And I had to come to work the next day and still put on my ED hat and continue from where I stopped the day before. But somehow I've made it work, and so far I'm juggling both balls.
Yeah. And what's important about what you've said are the two roles, even though they're worlds apart, there is the infusion of tech in both worlds. So you're able to align that vision of tech-supported solutions in both Viedial and TA Connect. Okay, so whether you are leading a large donor-funded program or a lean tech startup, you have to make hard decisions. Can you share a time, either at TA Connect or Viedial, where you had to make an unsentimental, for the greater good decision that was unpopular in the moment, but necessary for the organization's survival?
Yeah, as you say, at work, just as in life, hard decisions are unavoidable. However, I will try to give you a concrete example from TA Connect, aside from hiring and firing decisions. At inception, TA Connect was conceptualized as a grant-making organization by our primary donor. In other words, we're to receive donor funds and serve as a grant maker to other organizations, some of which were local, some international. 2 years into this operational model, however, it became clear that this mode of operation restricted the amount and types of funds we could attract from other donors.
Right.
And I had to make the hard decision to have us operate a dual model of being both a grant maker and a program implementer. Now, at the time, it was not clearly understood by most people, including my board, if I might say so. However, barely a year later, it quickly became evident that this was the best course of action for the organization. And it resulted not only in our survival, because now events happened that would have left us out in the cold if we hadn't taken this step before. And it now led to not only our survival, but our expansive growth beyond initial projections. It's also resulted, of course, in us having more donors and being able to attract, additional new funding that is quite major in a period where most organizations were losing their funding sources.
Right. That was a very discerning and calculated risk you took. But it was a dual model which worked. So being a grant maker and a program implementer was seen as acceptable and the best way to fund the business. So that's great. Okay, we have many listeners who are medical professionals or experts in their fields. but they are terrified at the word business or startup. They have an idea like Viedial, but they stay in their lane. As a doctor who crossed that line into entrepreneurship, what is the one business skill you had to learn the hard way that medical school never taught you?
Believe me, it was no walk in the park for me either, because I wasn't born knowing, neither was it taught in medical school, as you said. I'm even yet to do an MBA, which is my next target. But in my case, right, I think I gleaned a lot of knowledge from my co-founder, who was more knowledgeable in business and in the IT world that I was. Hence my decision to step back and let her take the lead in the organization. But we also did lots of courses and programs that cost some sleepless nights. I think I alluded to that also earlier. We first did a business accelerator program, which was about 3 months, followed by an business incubation program for another 2 to 3 months, both with some big Canadian companies, just to get a full grasp of what was required or expected. All I really remember now is a lot of sleepless nights, assignments that had to be completed in a timely manner before accessing new training modules. Through it all, though, I learned that execution of your business as planned does not really translate to conversion of your users to customers, nor money in your account. I thought your users, if you have users, you have 3,000 people signed up, had taken the screening test. Oh, of course they've, subscribed. Nope. So customers are those who pay to use our solution. And it's always important to know your market segmentation and the conversion rates from these users to customers, to help forecast and make business projection correctly. This is one thing I learned, and it has never left me since then. This is one thing I learned through the business programs that we did, both in the acceleration and incubation. It has never left me, and I'm seeing it play out day by day by day. So this is always in my front pocket.
Yeah, I think they took away 2 points there. The first one is, as a leader, knowing when to step back. You understand your skill set, but you also understand the other person is more qualified in a particular field. The second thing I took away is always be learning. It's really important that we never stop learning. And you show that by, attending accelerator programs, those sleepless nights, working really hard to fully gain awareness and understanding of your industry and the product that you're trying to sell. So I like that.
Thank you.
Okay, Lilian, your last question. Looking at the full picture, from saving mothers in rural Nigeria to using tech to prevent heart attacks in Nigeria and beyond, your career is defined by impact. If you could go back to the young medical student starting out, what was the one piece of advice you would give her about the power she holds to change the world beyond just writing prescriptions?
That's a deep one. So now, the medical student I was always wanted to be a pediatrician until I discovered public health just before final year. I would caution my younger self not to be anxious about anything and to let her passion drive whatever she chooses to do, because with that, impact is sure. So whether it's about mothers and newborns, I'm very passionate about that. Whether it's about preventing non-communicable diseases or cardiovascular diseases or diabetes, I'm also equally passionate about that. I would also emphasize the value of mentorship, which can cut short her journey to self-realization and actualization, and the fact that new skills can be learned at any age with determination. Lastly, to never stop learning and trying new things, as the world is our oyster.
I would call that a mic drop. Lilian, I'd like to say thank you so much for sharing your insights. I am very much interested in this app because it would help one way or the other. So if it's not helping me keep track of my health, it's helping me with a plan that I could use if I have any health issues. So thank you.
Thank you very much for having me, Lolita. I appreciate it, and I'm a big fan of the podcast. Thank you.
There you have it. I always like to bring in insights around healthcare because it's so important the way we manage our personal health. We have guests who have suffered from health issues, but now we want to prevent more health issues coming in the future by just checking in. So I hope that everyone takes the time out, 1, to rest, 2, to be conscious of their health status, and 3, go see a doctor if you really need to. Again, I'd like to say thank you all for joining us on the We Win podcast today, and do have a healthy day.